Could you please introduce yourself by telling us your name, your membership status of the college and your medical specialty?
So my name's Professor Angela Thomas. I'm acting president of the College of Physicians of Edinburgh, and by training I'm a paediatric haematologist.
I'm going to start by asking you questions which relate to how coronavirus has impacted you in your professional role. Can you describe how the coronavirus pandemic has affected your working hours and practices?
Well, I actually retired from active medical practice at the Royal Hospital for Sick Children in Edinburgh in June 2017. But there was a call for doctors recently retired to come back and help out during the pandemic. I was very much aware that my colleagues in the haematology department at the Children's Hospital were very hard pressed because the junior doctors who work on the wards and help look after the patients and so on had been redeployed, and therefore consultant input had to be drawn away from other things which are very important in our area of medicine to work on the wards, which meant that the clinics were comparatively unmanned and so on. So I put my name forward and came and did some clinics at the Sick Children's Hospital over a period of a couple of months, which I understand was helpful as it did free up my colleagues to do the things which are, I said, keeping the registries properly for the children who are being treated for leukemia, updating the operating procedures, which was really important during the change in working practices at the hospital. So I think the thing that I noticed most when I went to the clinic is that there weren't very many patients there, in fact hardly any patients, because we did most of the clinics over the phone. It was in a way quite enlightening or educating because we sat there, went through all the patients first, discussed what the problems were, and ensured we knew exactly where the patient was, either in their treatment or their disease process and so on, and then arranged to call them at a set time and have a chat on the phone about any particular problems. For me it was particularly nice because actually quite a lot of the patients I realised I knew from before, and I even had the pleasure of looking after a small child who I looked after one of the parents for many years, and they'd inherited the same disorder, and therefore it was a sort of nice connection to make. A few patients did come into the hospital. The children didn't need to wear masks, but the parents did. And at the time I worked, it was during the initial lockdown, and so only one parent could come in. You realise that actually how much information you have from two parents being there at the same time in terms of how their child is doing, but also when there's a problem with translation, because the mother would bring the child and they wouldn't necessarily have English as their first language. So communication was a little bit different, but I think we got there.
There's been increasing articles about the potential long-term health impacts of coronavirus. Do you have any comments on what you think the long-term impacts will be?
It's difficult to know, I think, what the long-term impacts would be, simply because the disease has been with us for such a short time. But it is apparent that there are similar types of post-viral effects, such as ME and sort of things that I used to always associate with glandular fever, but there seem to be some very specific ones associated with COVID, affecting all sorts of different organ systems, such as the liver and the lungs and the kidneys and so on. So at the moment I think there needs to be a really important data gathering exercise whereby symptoms that you think may be connected with the virus are reported and collected. And maybe it's a little bit like adverse effects with drugs, where you're not entirely sure whether it really is that drug, but the thing to do is report it, and you may find it then sets up a signal saying, oh, actually quite a few people have reported this very same thing in the same circumstances. So I personally haven't come across long COVID in the patient population, but I'm not working in paediatrics. It's not something that we necessarily expect to see as obviously as in the adult population.
So in a similar vein, do you have any comments on the long-term effects of the pandemic on the National Health Service in the context of provision of care, funding, structuring of care?
That's quite a big question. So one of the things in Scotland, particularly working in a service such as paediatric haematology, where some of the diseases you look after are very specialised, there have been MDTs set up for quite some while, which have connected via video conferencing facilities the different areas in Scotland because there's such a much larger geographical area. So So we've been used to video conferencing, but for specific problems and not necessarily with patients there. So one of the very big differences that has been seen is the increased use of video conferencing and video consultations with patients and parents. When that first started, it seemed very liberating. You spent little time travelling. People got used to the fact that if you spoke when mute was still pressed, nobody could hear you. And so people became more comfortable using it, and it was I think, a very positive move. However, after a while, one really misses actually being in the same room as a colleague or being in the same room as a patient. And in fact, for some illnesses, you need to be in the same room as the patient to be able to deal properly with what's wrong with the complaint. And also, people have mentioned using the sort of video type facilities. The last minute, oh, by the way, doctor, did I tell you about this? I think people are worried that those sorts of throwaway symptoms or concerns may not be picked up. So delivery of care is, I suppose the word is blended. People are using it now. Sometimes you see the patient face to face, and sometimes you're using video facilities more. But I think that can be advantageous in that you now can get people together in a group much more easily to discuss things because there's no travel involved. I think one of the other differences is the idea of triaging patients. I think in Scotland we've had the COVID-19 hubs, where if you have symptoms that were potentially COVID, that was a specific place that you run. People there would have, or people manning it had very specific expertise in the sort of the presentations of COVID, and could triage patients so that instead of everybody with a slight temperature or everybody with a bit of a cough going to casualty saying, I think I might have COVID, can you see me? That they could be triaged so that a reduced number of patients with a much higher likelihood of having the disease were sent to casualty. It would be interesting if that model could be rolled out for other diseases or illnesses. So if patients have potentially a broken arm or broken leg, yes, they will need to go to casualty. But if they have other less specific symptoms, it might be possible to do some triaging before they turn up in casualty so that they can go and access more appropriate care. For instance, with mental health, it may be much more appropriate to go to a mental health facility where people are trained specifically to look after patients with a crisis than turning up in casualty, which is busy with lots of other things. So looking at ways of directing patients more efficiently and effectively earlier on in their illness path may well be something which can be carried forward.
Do you have any comments on how the government has responded to the pandemic, either the UK government or the Scottish government, or both?
Well, I think the thing is that COVID-19 was an unknown disease when it first hit the UK, and in fact will hit the world. And so people weren't really sure how it was going to work out. Different countries have done different things. I think it's very easy to say, oh, well, that went wrong. You can see what went wrong there. When things have gone very well, it's difficult to determine why that happened. And it may be that they're going to be partly country-specific, nation-specific, that what works well in one area may not work so well in another. But one of the things about the UK is, I suppose, it's a small country. There are 4 different nations, and each has had its own rules about how to look after the population as a whole. But the geography is very different. So in Scotland, the rules have been perhaps slightly stricter, and we have a larger area of where our patients are. So, trying to look after patients over that large area presents one problem. In other parts of the UK, there are many more cities where people are much more closely inhabiting places in a sort of more concentrated way, and therefore there may be different rules which need to be looked at. I think one of the important things is the messages initially were fairly simple: stay at home, wash your hands. Well, we didn't wear face masks initially, but then encouraging to wear face masks, and if you are symptomatic, you isolate or you quarantine if you've been in touch with somebody who has got symptoms. But as there's been a relaxation, I think, in the rules of how much you can go out and so on, and that has varied in different parts of the country and between the nations. Actually, what is quite difficult is for people to remember, although you can go out a bit more, you still need to do those things, which is wash your hands, good respiratory hygiene, isolate, distance, and so on. I think one of the things that has confused people is simple messages can be remembered, but when there are lots of different messages with slight changes in what you are supposed to do, it can get confusing to follow the rules properly. So although there's no doubt there needs to be some variation across the country because of various different pockets and concentrations of the disease, it would be really helpful for all four nations to work together to keep the messaging as simple, concise and uniform as possible, so that whatever the relaxation and the restrictions are, people know that, as I said, the basic things which I've said, I think, already a few times, is to wash your hands, respiratory hygiene, distance, isolate, quarantine.
This is you've covered this to some extent already, but just to ask in case you have anything else to say. So how do you feel the public have responded to the pandemic, and with these changes, as you said, the hygiene, the social distancing, wearing masks, do you think these will to any extent remain longer term, or are they very temporary?
I think the awareness of the importance of hygiene may actually last longer, and I hope that it will. I mean, you see pictures of children back at school routinely swabbing their desks down and washing their hands and sanitising them, and being aware that, you know, there are germs out there and they must protect themselves. So I think there may be a positive longer term effect of this increased awareness of hygiene. I mean, one of the very first sort of times it was realised that what you did could really affect infectious disease was when hand washing happened. I can't remember when it was a lister of some sort that introduced it, but realised that if you washed your hands between patients you didn't spread disease. And it's a very simple thing to do. Everybody, or almost everybody, can do that. And actually just getting back to that basic hygiene should improve the transmission of many diseases, or rather reduce the transmission of many diseases. And we may see that with flu this year, I don't know, but you'll see it with all sorts of gastroenterology sort of type of diseases and other infectious illnesses.
Thank you. So next I'm going to ask you some questions about the personal impact of COVID on you. You can share as much as you like, and if there's any questions that you don't want to answer, then please just feel free to say. Have you had, or do you know of any colleagues, friends or family members, without naming people, who have personal experience of contracting coronavirus? And if you're comfortable with that, are you willing to describe?
Nobody that I'm particularly close to, I think, I'm aware, has definitely had it. There are people I know who said, well, I did have loss of smell for a bit, but I'm much better now. They were quite young, and it's possible that that was their only symptom. They weren't actually ill. A couple of my friends were very unwell around Christmas and the New Year with, if you look back now, I think, oh, well, that was a little bit like coronavirus, but I don't know if that's what it was. And somebody else who had a very severe respiratory illness which would fit for COVID, that I don't know particularly well, but heard that had affected them. So no, I'm not very aware of people who've had it. My mother, who's 89, lives with us, and therefore we have been pretty strict about keeping distance from people, and actually only go shopping once every 2 weeks, which is quite a logistical exercise, to just try and not sort of get out there and mix with people, so keep that reduced as much as possible. But actually the first couple of months I quite enjoyed it. I wondered if I was a closet sort of recluse, if one can have a closet recluse. And I quite like it when I went running. I could run down the middle of the road if somebody was coming and there wouldn't be any cars. And so now that it's beginning to get busier, because I have been out and about, I'm much more aware of keeping away from people, but I haven't lost my confidence. Whereas my mum, who hadn't been on a bus for a couple of months, and we went on a bus together, and she was very, very nervous about going out. She was very cross with herself for being nervous, but she couldn't help it. She just hadn't been out. So the effect on her, although what she's done on a day-to-day basis hasn't changed hugely, but the effect on her confidence has been great. People say to her, friends say, you must be really nice for you being with your family all the time, you're not at all lonely. And she doesn't always answer. I think it has been, I'm very pleased that we've all been able to be together so that I don't have to worry about her. But equally, having living in a house all together has its own interesting spin-offs.
You've slightly touched on this in your last answer, but just in case you have anything else to add, could you describe how your home life routines were impacted by lockdown?
So home life, initially it was just strange not going out, and everything you were going to do got cancelled and holidays got cancelled. And we tried to get into a bit of a routine, so during part of the, towards the evening, say, right, we'll sit down and read for an hour together. I think that lasted a couple of weeks. A very old school friend of mine who used to be a dancer and runs a gym was doing online Pilates, so I thought, well, I'll do that on a daily basis, and that was quite fun. And then I thought better go running a bit, and that was quite fun. So for a while I felt things were going okay, and then work got very busy, and so all the nice routine I'd got into suddenly was not possible to carry out, because obviously there was the responsibilities of being the acting president of the college, and the interaction with government, with other clinicians, with the other Royal Colleges became really important in pooling information, talking through problems, and so on. So from one of being fairly relaxed to being really, really busy with hours of video conferencing a day, but very interesting, fascinating to see how things are evolving, being able to talk to people, saying, are you seeing this? What have you done about that? And being able to try and hopefully get some of the main messages out. Not that what we're being told, should we go outside? Can I go to a pub? Can I go to a shop? But what can I do to help protect myself, to help protect other people? Just very simple things to remember to do to try and improve, reducing transmission of this disease.
And this is the final question. Where do you go for accurate information on the pandemic? And do you have any thoughts on the role of social media and the internet in sharing information with the public generally?
Okay, so I'm not a member of Facebook. If one's a member of Facebook, I don't use Facebook. That's given the game away completely, hasn't it? And I haven't done for many years, so I never quite understood it. And I don't use Twitter because I always read right to left or left to right, and I can't work out which way the message goes. So I don't use those two things, but I do use the net a lot. I've got one or two COVID apps which have been quite helpful in giving you an update. You can put in your postcode and find out how many cases there are in your area and so on. So for accurate information, I also quite listening to some of the podcasts on COVID, which initially were on a daily basis, and you could see again problems evolving, what was happening to cases and things. And I guess talking to colleagues, being lucky in this position that have been able to have access to accurate information fairly directly from sources from the NHS and some government sources. Yeah, so I've had access to numbers and things more directly from the NHS. So I've been quite lucky. What I've tried to do is keep with colleagues in the digital and web teams at the college to important pieces of information or changes in information and so on, trying to put them up on our website to help doctors and be able to tell their patients some of the up-to-date information, or where they can find resources to look for further information and advice.